Have you ever gone to pick up a prescription, looked at the price, and thought, there is no way that can be right for that little bottle? Well, you're not alone. I sat down with Rachel Strauss, who's featured in the documentary Side Effects May Include, to talk about why the same medication can have wildly different prices, what's happening behind the scenes, and what you can do so you don't walk away from the pharmacy empty-handed. Rachel, as you know, you very well know, frustration's at an all-time high when it comes to people's health care, prescriptions. And I'll just share one story with me. I was so upset because I couldn't figure it out. I went in and the person said, okay, this eye drop is $600 something. I'm like, okay, but why is it I have insurance. It's with insurance. He goes, it's $600 something. I was so mad I left, but I knew I had to get it filled because I needed it in order for my eye to get rid of an infection. And I end up going to another pharmacy and the person goes, oh no. He goes, let me check. And he goes through one of the apps, like a GoodRx, and he goes, how's $39? I'm like, why couldn't it be $39 to begin with? This is crazy. This is a field that you used to work in, the PBM system. Explain to us what that is.
Sure, so I still do work in it. I'm just on the other side of it. That's the fun part.
Because it used to be on the other side of the side of it.
Correct. So PBM, it's one of these insurance terms that they throw at you and expect people to know what it means. It stands for Pharmacy Benefit Manager. And what most people don't realize, Deb, is that more than 98% of every prescription drug that's processed in this country is going through a pharmacy benefit manager.
So it just doesn't have a straight price and here's what it is and everybody can buy it for what it is.
Correct. The pharmacy benefit managers, and we're going to talk about, I know, the documentary that I was involved in. It talks about what the purpose of a pharmacy benefit manager was, 40 years ago. PBMs were created to create bulk purchasing and essentially assist pharmacies in getting, patients to come utilize their stores. What it's turned into is almost the handcuffs of our system of who controls what drug you can get, what price you're going to pay, where you're going to pay it, and really if you have access to it or not.
Yeah, and it's interesting to find out that every pharmacy doesn't sell the same drug for the same price. You almost have to shop that as well. All right, what made you go to the other side?
Sure. So I worked for a pharmacy benefit manager, and I will say not every PBM is bad. Right. There are a subset of the industry that have for many years been trying to do things correctly. The word that's used is transparently, showing the pricing, allowing consumers choice. But really, after 20 plus years working for the same company right out of college, learning everything I could about the industry, I realized my impact was bigger than just representing one company, one solution. Really, the documentary we're going to discuss today was that Jerry Maguire moment. It was, I have an opportunity to be a part of something that will get a message out. And in order to really take that message and scream it without it being about a sale of a product or pushing anything, I made the decision that this is how I was going to spend chapter 2 of my career.
Yeah, because it affects everybody, if not now, at some point. You had a son, or you have a son, Leo, born with congenital heart disease. You had to navigate that healthcare system, not as a professional in the business, but as a parent, and you experienced that same kind of frustration.
Absolutely. I was very lucky to be here in Houston and have, Texas Children's Hospital at our backyard, but I was diagnosed in utero at 20 weeks, learning my first child would have congenital heart disease. He has tetralogy of Fallot, TOF. I'm very public about it on the off chance one of our viewers today has somebody in their family. We're very open and accessible to any parent navigating, but all of a sudden, I was that patient, right? I was not the person looking for the best price. I wanted the best care. And that's when all the bills start, right? I mean, you start getting tests and, echocardiograms and x-rays and all of the different things.
And you have no idea what's going to cost you up front. It's like you'll get a bill.
You'll get a bill. You'll deal with it later. And then, the child is born and Leo spent 27 days in the NICU at Texas Children's. He had open heart surgery just shy of 4 weeks old. Really understanding we do what the doctors tell us, but have no indication of what's going to happen on the bills. Yeah. And that was the time for me when the explanation of benefits started coming in, and those are the things the carriers send you, and it says very, blanket, this is not a bill, but you pay attention, because these are numbers that you can't afford. I mean, the average American can barely afford their out-of-pocket, let alone the hundreds of thousands of dollars of bills that hospitals can send.
Even, we're talking about people who even have insurance.
Correct, and I had insurance. I had insurance, but I knew from doing what I had done for so many years, that nothing was a first offer, take it as a first offer, and that really I'm going to want to negotiate whatever I can, both my out-of-pocket as well as what the hospital's trying to take advantage of.
And most people are like, look, I've been through enough. Why am I negotiating a cost? Why can't it be like when I go to the store and buy something, this is what it costs, and I can decide what I can pay?
Correct. And I'll tell you, having mentioned that my husband, Levi, and I are very outspoken for the heart parent community, really internationally. In the United States, when parents reach out to us, the very first question we get is usually about the bills from the fathers. The dads are, and this doesn't, men, women, it just seems the women are on the emotional side, which I can relate to. But the husbands typically go right to, what am I going to do with my insurance? How can I figure out if I'm going to be able to afford taking care of my child? And it's blaring how frustrating and scary our health insurance system here is in this country.
Which leads you to side effects may include the documentary.
Yes.
That you have so many people depending on a particular medication, but what's standing in the way is the cost. And so there is a story that you want to share right now that wasn't part of the documentary, but the importance of the film. This young man named Cole and his family, 22-year-old asthma patient.
Yes.
He's on, medication.
And he was on his father's insurance. They worked at the same company. And essentially what happened is, he had been on the same inhaler, Advair Discus, very popular name if anybody's listening whose child might have asthma. It's been out for a long time, filled it every single month. January 1st rolls along, he goes to fill his medication, and he's told his out-of-pocket is an unattainable number, several $100s. I believe it was $600, give or take, that he was told. And at 22, that is, who has that kind of money, let alone potentially access to that on a credit card?
Yeah.
And he made a choice at that moment when he was told the dollar amount to go home and not fill it. Where the system wronged Cole, the system wronged him in a number of ways, but having spent so many years on the inside of the industry, I know for a fact that every pharmacy has the ability to see what drug you fill and how often, right? So first and foremost, the pharmacy knew that this was somebody likely with asthma who's filling a medication monthly every year.
Life-saving medication.
Correct. Next, they gave him a price. Now, the story that, that we all know is that he was not given any alternatives, that he left, just said no thank you and went home. Now you spoke about turning down medication. Did they give you alternatives?
Well, mine didn't give me alternatives. What he did was found a cheaper price.
A cheaper price, right.
Yeah. So I was like, okay, now we can do this. But for him, it was like, this is the price, next.
Correct. That is, yes. So that, and that's the story his father tells. And so he went home, did not fill the medication. And this is the worst case of the system wronging somebody. He unfortunately did have an asthma attack, did not have the medication, and passed away. We live in a world, Deb, where we are, I know if I fill my medications, if I don't, pick it up from the pharmacy, I am getting text messages frequently. It's time to refill my drug. Did you know your drug is ready? They do enough reach out to come get you into the store. The same reach out should be happening when we don't fill life-sustaining medications. We have the knowledge, we have AI, we have apps, we have cell phones we're attached to. I believe that with pharmacy benefits, we are in a world where people should know how to get their medication, what it's going to cost, where their alternatives are, and then ultimately physicians need to know if their patients aren't filling their medications.
Yeah. Or another thing that happens sometimes, patients will half their medication, half their dose, and sometimes that can be problematic in all kinds of ways.
Correct.
All right. In this documentary, what do you want people to walk away knowing?
So the documentary was really meant to, number one, explain what a pharmacy benefit manager is. I had a selfish reason for that point. I've worked in the industry for more than 20 years, Deb, and my best friends did not know what I did for a living. I mean, we would be at a cocktail party and they'd roll their eyes if somebody said, Rachel, where do you work? Because it was so complicated for them to even understand it.
Yeah.
So this documentary, number one, I wanted people to understand what it's about. Number two, I wanted people to get angry. I want people to understand that there are other ways to fight the system. The number one purchaser of healthcare in this country, Deb, are employers, right? And here in Texas, we have probably, arguably, the most number of employers buying health insurance in this country per capita. We need employers to understand that they have choices and that we have companies, even based here in Houston, whose name you may have not heard of, that actually may have better access to health insurance or ways to pay for your medication than the names that used to be on the cards. if people see this documentary and get angry enough, that's when we get change. We leave people at the end of the documentary with hope that if you start questioning the system, if you start educating employees on what you're buying on their behalf and no longer use it just as a retention tool, but really how to keep people healthier and keep our workforce strong, that trickles down to later generations. And really, if people start to understand not just how it works, but where they've been taken advantage of, that's when we start to fix it.
Yeah, all right. Let's leave today with one thing someone can do if they're going in to fill a prescription and that price all of a sudden has changed and it's almost inaccessible.
So first and foremost, don't leave without your medication. If you are on a life-sustaining medication, if you are on something that you need every day to get up and live your life, don't walk away. Ask the pharmacist first and foremost if there are other options.
Is there a generic brand,
Is there a generic? Is there something else I can take? And if the pharmacist unfortunately does the I don't know, leave, call your doctor. Make sure that you are getting medication. That's the first and most important.
Yeah.
Next is reach out to somebody like me. I am an advocate. I'm here to help people find access to healthcare. Really wanting to make it affordable for people. The problem with transparency is that the internet doesn't make it any more transparent. We're starting to see things
it almost can get more confusing.
It can get more confusing, but things like GoodRx at least give you a basis of what the drug should cost. TrumpRx at least give you a basis of what that medication should cost. But look for advocates in this space. My website, rachelmstrauss.com, can help guide people, but there are a number of advocates in this space that are there to help you get those medications.
All right. Well, thank you very much for being a good prescription for today.
Oh, I like it. No problem. Take as needed.
For more information on the documentary, side effects may include the hidden cost of prescription drugs, and to connect with Rachel Strauss for strategies on navigating the modern healthcare system, visit rachelmstrauss.com.